Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Hi, everybody. It's Dr. Rinku Mehra. I am your host of the Endo Kids Podcast. And today I am so excited to have Dr. Jessica Ritch with me today. She is an OB-GYN. So, Dr. Ritch, can you give us a brief introduction about yourself?
Of course. And thank you so much for having me, Dr. Mehra. I'm really excited to be here. So as you mentioned, I did train as an OB-GYN, and then I did some additional training in minimally invasive gynecology, which basically is 2 additional years of training after the usual OB-GYN residency, where we focus on a lot of these conditions that affect menstrual health. So things like PCOS and endometriosis and fibroids, along with other things, but really getting down to the meat of common problems that affect women every day that often get ignored or swept under the rug because a lot of OB-GYN focuses on pregnancy and on cancer. And these are the things that sort of get ignored, but that are really the focus of minimally invasive gynecology.
So how did your training in minimally invasive gynecology shape your perspective on adolescent menstrual conditions?
Right. So that's really where it all begins, right? So, of course, when girls start having their periods, it can come in all sorts of ways, shapes, and forms. And a lot of these conditions, like PCOS and endometriosis, really start to show themselves in the teenage years. And many times get ignored for years and years, sometimes because the girls' mothers and aunts and everyone else in their family has similar conditions and have just been told this is part of being a woman and part of the suffering that goes along with it. And it really can cause a lot of disruptions in the lives of teenagers and then into adulthood and affecting their health down long term. So learning about these conditions more in depth and being able to treat girls starting in their teenage years and then into adulthood has really been important for me in my career path and with my patients.
Yeah, so, I often talk to my patients about their menstrual health, especially the teen girls. And I talk about the menstrual cycle as being a vital sign for teens. And I wanted to ask your opinion on that. Why is menstrual health in adolescence so important for long-term well-being?
I agree. It's like a vital sign, or I often tell my teenagers, it's kind of like your report card for your health, right? If we think about it like school. If your periods are normal, if they're happening pretty regularly, which means, anywhere between every 21 to 35 days, if they're not too painful, if they're not too healthy, it's a pretty good indication that you're in good overall health. But when things are going wrong with your health, when you're, not getting good nutrition, when you're not getting good sleep, when you're under a lot of stress, it really shows up in changes in our menstrual cycle. And then when we have conditions like some of those that we're going to get into a little bit more today, it really can affect your long-term health, not only how your menstrual cycle is, but your heart health, your bone health, your mental health. It really can affect every part of your body.
Yeah. So, what are some of the common misconceptions that parents have about teen periods? Because I hear a lot of parents saying, well, my periods were heavy, so that's what I just assumed that her period was going to be heavy. Or I didn't have menstrual periods for 3 months at a time, so I just assumed that my daughter would be the same. So what is your thoughts about that? And what are the biggest misconceptions that you hear from parents?
Yeah, I think you really nailed it. It's really whatever mom's periods were like is typically what they expect their daughter's periods to be like. And this can go in different ways. So if mom had a perfectly clockwork, regular period without any problems, and then daughter's having problems, it's kind of like, oh, well, what's going on here? Something's wrong. And sometimes it may just be a different type of cycle. But on the other hand, what I see more commonly is that, moms had either very heavy or irregular or painful periods, and maybe so did her sisters, or so did her mom, or so did everybody in the family, because a lot of these conditions do run in families. And then they just assume, okay, well, this is what a period's supposed to be like. And when the daughters start to complain about what they're going through, it's kind of brushed off as this is just part of life, or this is just how women in our family experience this. And it's really a shame because many of these conditions are very treatable, and we don't want to ignore the problems.
Yeah. So, when should painful or irregular periods be taken seriously? What is your thought about that?
Right. Well, so irregularity is pretty common in teenage girls, especially when they first start having periods.
Hmm.
So I know a lot of moms who might expect, okay, my period's been clockwork, so my daughter should be clockwork from the get go. And that's pretty
Hmm.
rarely the case. It does happen from time to time, but most often it's not like somebody's going to get their period and then they're going to get it every month after that perfectly. So there's often some initial irregularity in the cycles, in the first usually couple of years that girls are having their periods. And that I don't worry about too much. I also don't worry if somebody, just has a one-off period that was either late or a little bit early or a little bit heavier or a little bit shorter or a little bit more painful. It's really patterns that we're looking for. So if somebody starts getting their period and then it's really only coming like every 3 months or 6 months or completely unpredictable, and that's persisting for more than maybe 6 months or so, that's when I would start to look at it. And definitely, if people are having heavy and painful periods that are keeping them from school or from sports or from doing the activities that they like to do, that's when I would consider getting an evaluation as well.
Yeah. So typically, my training has been to tell teens that for the first 2 years after they start having menstrual periods, that they're going to be pretty irregular. And then after that time point, we can really start to evaluate and keeping track of when you're having your period is
Mm.
what I've been telling, teens to do. But you're right. I mean, parents come to me saying, well, she doesn't have a 28-day cycle. And I think that's actually okay. That's normal to not have a 28-day cycle, right? I think there are, the majority of women have, varying cycles and they're not going to be on the clock every 28 days. But like you said, there's a pattern. So if they're missing period, and if they're missing, 4 months, at a time they're having a period or 6 months at a time. I think that's typically what I've told parents to say, that's the time that we need to take a look and see what's going on.
Exactly. And I agree that irregularity in the first couple years is very common. And so, yeah, it could be they get it 1 month and they don't get it for 3 months, and then they get it a month later, and then maybe it's 2 months later. That in the first couple years is very annoying, but not necessarily anything to worry about. But if people are really having that very heavy or painful period, even if it is in the first 2 years of the cycle, I would recommend an evaluation for that because you really don't need to be suffering. And if the irregularity is becoming very bothersome to their life, then you don't have to wait 2 years to get an evaluation. It just may mean that there's nothing necessarily wrong, but there are things that we can do to help that.
Yeah. So, I want to shift a little bit and talk about a common condition in teens that I see called polycystic ovarian syndrome, which I really do not like the name of that
Terrible.
condition. Yeah, terrible name. But I wanted to get your take on, PCOS and in parent friendly language. How would you explain PCOS?
Yeah, so PCOS or polycystic ovarian syndrome, which we will talk about why the name is so terrible. It's pretty common. The estimates are about 10% of girls and women. I think that that's really an underestimate because I do think so many of these menstrual conditions get ignored. But it is one of the most common endocrine conditions and one of the most common causes of abnormal periods, especially in teenage girls and young women. Basically, it's a combination of hormone dysregulation and oftentimes metabolic dysfunction as well. So, in order to diagnose PCOS, we look at three different features or three different characteristics. The first is having irregular periods. And that usually means going for longer stretches without a period. So, somebody who's going beyond like 35 days between their menstrual cycle, or maybe they're missing every few periods or so, that we would consider to be an irregular period that's consistent with PCOS. And it's typically because they're not ovulating on a regular basis. And we can get into that a little bit more later. That's one criteria. The second criteria is what we call androgen excess. So, what that means is, of course, all of us have many different hormones. Males and females have what people consider male and female type hormones. When we see more of those sort of male type hormones, like elevations in testosterone or elevations in DHEA, which is a precursor to several hormones, including testosterone, that can be more consistent with PCOS. And we either can see that in lab or we can see that in symptoms, things like acne. Now, of course, a lot of teenagers have acne, but we're talking a little bit more excessive or bothersome acne,
Hmm.
or abnormal hair growth, which can be either things like excessive growth on the face or body or loss of hair on the head. And those can both be signs of androgen excess. And then the third criteria is what we call polycystic ovaries. And this is where the bad term comes in because it
Hmm.
doesn't actually mean that you have cysts on your ovaries. It's really the pattern of the follicles. And follicles on the ovaries are just like the little egg houses, basically. So polycystic ovaries have multiple follicles around the outside, and that can be seen on ultrasound. But it's not necessary to have that pattern of the follicles to be considered somebody with PCOS because you really only need two out of the three criteria.
Yeah, and I think a lot of teens see that. They see that there's hair growth or their periods are irregular and they're worried that there's something wrong with them. And I think what you emphasized before is this is very common. So, the typical teaching has been 1 in every 10 teen girls has that, but I think it's actually a lot more than that because I'm seeing a lot more of that in the clinic. And like you said, it's often missed. The other piece of it and why I care about it as a pediatric endocrinologist too is that, like you said, there are metabolic issues related. So the diagnosis of PCOS from an endocrine perspective does give some of these teens a higher risk of diabetes. And that's, why we want to know about it so we can talk about prevention or talk about what to expect in the future. Do you do any counseling for your teens about that too?
Right, of course. So we care about PCOS for a lot of different issues. And one of them is that metabolic problem. So typically, what that looks like is insulin resistance. So, insulin is the hormone in our bodies that help our cells to take in glucose or energy from our food. And when we have insulin resistance, that's really not functioning well. And it puts us at higher risk of diabetes. It makes weight management very difficult. It can give more cravings, more spikes in the blood glucose levels. So there are a lot of issues that happen with that insulin resistance, and it affects how our ovaries function, and that really affects our menstrual cycles. So that's a really important component of PCOS. We also care for other reasons, like the symptoms, of course, can be bothersome if we're not ovulating on a regular basis, which is what's
Hmm.
giving that irregular period. Then you can go these long stretches without a period, and then the periods can be very heavy and prolonged, which can lead to anemia. If you're going these long stretches and the lining of the uterus is building up in abnormal ways, that can even lead to things like precancers and cancers of the uterus. And then because the ovaries are a little bit bulkier with all of these follicles, it can lead to things like ovarian torsion, which can be both very painful and a surgical emergency. So there are a lot of reasons why we care about PCOS
Hmm.
and why we want to know what's going on so that we can.
Yeah. So, what do you think, as far as the diagnostic criteria and labs and imaging? What do you think is the most important? Are you doing labs for everybody? Are you imaging their ovaries? What is your typical workup if someone
Yeah.
has irregular periods?
Right. So just like any workup, it always starts with the history. So getting a good view of the periods. And like you said, I do recommend that everyone who gets a period tracks their period
Hmm.
because some people may say, okay, it looks a little bit irregular, but maybe they're looking for a specific day on the calendar. And very few people are going to have a period that comes every like sixth day of the month, right?
Hmm.
For one, our calendar like isn't really created around periods. Some months have 31 days, some months have 28 days. So it's going to be a little bit different. And there can be some variation in those cycles. I always recommend to my teenagers and to adults to track your cycles. There's so many apps out there now that make it super easy that you just, touch a little button when you're having bleeding and you can kind of
Yeah.
track your ovulation and your periods so that we get a good picture of what that looks like. So it's always going to start with a history, looking at what the menstrual cycle looks like. It's going to be a conversation about those things like acne and abnormal hair growth. And if those are bothersome, it's going to be a conversation about whether cravings and weight management is an issue. I do often like to get labs, and that's for a couple of reasons. One is I do want to try to confirm, like, is there elevation in testosterone or DHT? I also look at ruling out other conditions that are maybe less common, but could be an issue, things with the adrenal glands or the thyroid that can cause, or even in the pituitary gland, and we're looking at prolactin and other areas. So we want to kind of rule out other conditions that can cause similar symptoms. And then I do look at a hemoglobin A1C, which is a measure of your blood sugar and insulin over the last few months to give us a sense of, if that insulin resistance is becoming a significant issue. And then lastly, I'll look at a CBC and iron studies because so many girls with PCOS, even though they're missing periods, when they get them, they're often heavy or prolonged. That can lead to anemia. So I'll typically get blood work. I do get ultrasounds often, but it's not a requirement. If somebody's already meeting criteria with the other two categories, I don't necessarily need an ultrasound to check on that. If the periods are heavy and painful, I do usually recommend an ultrasound, again, looking for other issues that may be causing that, but it's not an absolute necessity to get the ultrasound to make the diagnosis.
Yeah, that's super helpful for teens to really know what evaluation is needed. And like you said, often just a history is super helpful in the physical exam. And that's typically what I do as well. But what are the main treatment options for adolescents with PCOS?
Right. So there are several treatment options, and I always start with lifestyle modifications. I think these are critical no matter what additional treatment you're going to do if you are.
Mhm.
So, of course, most of our teens aren't super excited about nutrition, but it is so important. And this really means, avoiding a lot of the highly processed foods, eating whole foods, whole grains, fruits, vegetables, lean proteins. It can really make a huge difference in PCOS when we have a healthy, nutritious diet. Exercise, of course, is another important part of that. And, people can, of course, have PCOS and be suffering with it even when they're athletes and exercising all the time, but making sure that exercise is a part of your routine is really important. And then the other two areas of lifestyle that I always focus on are sleep, making sure that you're getting good, sleep hygiene, getting an
Mhm.
adequate amount of sleep, and stress reduction, which I know sometimes parents are like, oh, what do they have to be stressed about? They're teenagers. But,
Mhm.
teenage life can be stressful. They're dealing with school pressures, they're dealing with relationship pressures sometimes and different
Mhm.
things. So, having some ways to get that stress relief, I think, is important for everybody, even our teenagers. So, the lifestyle stuff has to happen no matter what. Beyond that, we look at a few different categories. So traditionally, birth control is a very common way that we treat with PCOS. And this can be anything from birth control pills to patches to rings to IUDs. There's several different options out there. And the point of the birth control is really to regulate the cycles to help to avoid some of that irregularity and the
Mhm.
anemia and to reduce the risk of precancers and cancers of the uterus. But it can also help with some of the androgen excess symptoms, so the acne, the abnormal hair growth, things along those lines. It's not going to cure the PCOS. It's really treatment of the symptoms and avoiding some of the complications. The other category that we look at is things like diabetes medications. So traditionally, we use a lot of metformin, which is a diabetes medication that's been around for a very long time. It helps with the insulin resistance and in many cases can be enough to help somebody kick back into a normal ovulatory menstrual cycle. So it can be very helpful. Now, people with a little bit more severe weight management issues are sometimes looking at the GLP-1s and these other newer medications, but I've had a lot of success with my patients with metformin.
Mhm.
And then we look at if the issues are more of the androgen excess sort of symptoms, things like spironolactone, which is an anti-androgen medication, can help with the acne and the hair growth. Now, for people who don't want to be on prescription medications, there are some herbal supplements that can be helpful. I wouldn't just say buy anything off of Amazon or wherever, but there is some good evidence about inositols can be
Mhm.
helpful in PCOS. And there's another sort of blend of herbal supplements that I like to use as well that's from a traditional Chinese medicine perspective. It's a supplement called Elix, Elix. And they also have some studies showing improvements in PCOS symptoms with that. So there are a lot of options. It really depends on the patient and what is bothering them the most and what their patterns look like and what they're motivated to do.
Yeah, that's great insight. I mean, the typical first line that I have always heard is birth control pills, but of course I use metformin quite a bit also. And I do have a number of teen girls and their parents who don't want to be on birth control pills. So it's good
Mhm.
to know that there are some other options that are available. And really it's what is bothering you the most? Is it the cycles? Is it often it's the cycles and then the hair growth also in the acne that I hear about quite a bit. So, it's interesting to see that you're doing things very similarly. At OB-GYN, I think we do things a little bit similarly. I think there was a study showing that endocrinologists typically use metformin more and OB-GYNs use birth control pills more. And so it's kind of interesting that, we're doing, very similar things for the treatment, but there is treatment available. And I think that's what everyone needs to know. The other thing I want to ask you about was traditionally there has been some stigma around PCOS, and I wanted to address that. If someone thinks that they have PCOS, how can parents and providers actually, physicians, nurses really support the teen without creating this shame or stigma at the diagnosis?
Right. So most teenagers don't want to have any diagnosis, right? Most people don't want to have any diagnosis.
Hmm.
Everybody wants to be normal when it comes
Hmm.
to their menstrual cycles, when it comes to their health. And so there's always a little bit of stigma around anything that's a little different from the norm. And I think a lot of the stigma with PCOS comes in the frame of particularly the insulin resistance and the weight management. And that can be very tricky. I see a lot of, sort of arguments between my patients and their mothers about the importance of the weight management side. And I see a lot of shame that comes back and forth in those areas. And I get it from both sides, right? On the mom's part, they want their kids to be healthy. On the daughter's part, they want to be a normal teenager and they don't want to, have self-image or body conscious issues. So it can become very difficult there. I think it is important to stress that this is a metabolic condition, that this is hormone dysregulation, that it's not a willpower issue necessarily, that of course we want to make healthy choices like we talked about before, but sometimes there can be a need for medications. And it's not a failure on anyone's part if medications are necessary when our bodies aren't functioning the way that they need to be. Sometimes we need a little bit of help with that. And I think just educating families on those factors and giving support and really having close follow up and listening so we can see, okay, did this work for you? What do you like about it? What do you not like about it? Like you mentioned, I think we have a very similar approach, but you're right. Most OB-GYNs will go to the birth control first because it's what we're most familiar with and what we use most commonly. Most endocrinologists with the metformin because you treat a lot of diabetes and are very
Hmm.
comfortable with that. But the point is there are all these different approaches. And if somebody doesn't want to be in birth control, they don't need to be on birth control. The only caveat that I would add to that is that if you are going these long stretches without a period, we do want to avoid the lining of the uterus becoming irregular in a way that can lead to things like precancers and cancers of the uterus. For somebody who doesn't want to be on birth control, we can try other options. But if they're going more than 3 months or so without a period, then usually I'll just give them a short course of progesterone to just thin out that lining a little bit as well.
Let's talk a little bit about adolescent hormone health and future fertility, because I think there's a lot of questions around that. And that's what I hear moms often worry about the most is my child going to be able to get pregnant? And are there fertility concerns? And how would you counsel someone worried about that for their teen?
Right. So I hear the same thing, and definitely, the moms are usually the ones who bring it up because they're worried about the future and they want to make sure that their daughters can get pregnant if they want to and that they can be grandparents if they want to. But my girls worry about it too. The teenage girls, they're not obviously thinking about pregnancy now, but it may be something that, they're really concerned about in their future. And to be honest, there are high fertility issues in those with PCOS. Up to 80% of women who have PCOS may have difficulty with fertility. Now, that doesn't mean that they can't get pregnant, and it doesn't mean that they won't get pregnant. People with PCOS get pregnant all the time, but it can be more difficult. We talked about how that irregularity can usually be because they're not ovulating. If you're not ovulating, you're not making an egg. That egg can't get fertilized and you can't get pregnant. So for someone with PCOS who's maybe ovulating 6 times a year versus someone who has a regular frequent period who might be ovulating 12 to 14 times a year, you just don't have as many chances to get pregnant when you have PCOS. So it can be more difficult. It can take longer. All of the treatment options that we talked about, except for the birth control, of course, because birth control is definitely not going to help you get pregnant. But all of the other treatment options can help you to get into a more regular ovulatory cycle. So that's the lifestyle modifications, the metformin, the herbal supplements. All of those can help you to get into a more regular ovulatory cycle naturally, which can improve your chances at pregnancy. But sometimes it does take treatments with a fertility specialist to induce ovulation or to do other methods of getting pregnant. But it's definitely something that is possible and common for those with PCOS. So I always remind my teenagers that if they're not trying to get pregnant, even though it is harder with PCOS, they can get pregnant and should be doing something to prevent that when they're not. And that when they are, doing the things that will help optimize their health in the best way, can really help to improve their chances.
So I think that's important for parents to understand and not be staying up at night worrying about whether their child is going to be able to get pregnant or whether they're going to be able to be grandparents, like you said. What do you recommend as far as follow up into adulthood? So say, you have a teen girl diagnosed with PCOS, you get her started on medication, whether it be birth control pills or metformin or a combination, and her period's regular. What do you recommend in terms of follow up? How often should you be seeing them? How often should they be getting evaluated to make sure their symptoms are treated? What do you think?
Yeah. So initially, you're going to want to see patients a lot more frequently. And that's really going to be a sense of, okay, we're going to start a treatment. We want to see how that affects you. And pretty much, I always tell patients anything that we're doing hormonally, anything that we're doing for your periods, it's going to take us a good 3 months to see what kind of effects that you're going to have. So usually we'll start something and follow up 3 months later. Of course, if they're having issues, if they're having side effects, we're going to follow up sooner than that. But once we get into a good treatment regimen, we can let that go for a bit. But what I often see in my patients is they were diagnosed with PCOS when they were 16, and now I'm seeing them at 24, and they've just been on the same birth control for the last 8 years, and it's been working fine, but they are now thinking about fertility or they're thinking about something else, and they want to know what's going on with their PCOS. So I do think that, it shouldn't just be a set and forget sort of thing, that there should be an ongoing conversation, at least annually, to check in and say, okay, well, what are the symptoms? How is the treatment working? What are your goals now at this point? And is this a time where maybe we should start coming off of the birth control if that's what you're on, to see what your cycles are doing, to see what your chances are for fertility? Or if you're having new symptoms that really aren't managed well, do we need to do something a little bit differently? Or if you're having more of the insulin resistance type of issues, should we be on metformin instead of the birth control? So I do think that at least once a year, that conversation should be had, and it should be more than just an annual visit with a pap smear. It should be a conversation specifically about the PCOS and monitoring what's going on with your symptoms.
I think the other piece of advice I sometimes give my teens is what you talked about earlier, which is lifestyle modifications. And I think that's really helpful to have that conversation, at least like you said, once a year, to make sure, because teens are also going through that transition life, right? And then when they're ready for having a family, really focusing on that too, and having sort of that holistic approach, I think is really important, like you mentioned.
Definitely, especially that transition, out of the house, and now you're responsible for your own meals. And are you going to the late night snack shop on campus? And
Right.
getting French fries or are you making sure that you have good nutrition? And so I think that is a really important conversation to have.
Yeah. So this has been so helpful. So, Dr. Rich, if you could leave every parent listening with one key insight about adolescent menstrual health, what would that be?
I think the biggest thing to know is that periods really are important and they're not just something that girls and women are supposed to suffer through. Periods are not meant to be so heavy or so painful that your daughter is missing school. They're not supposed to be so unpredictable that they're surprising you every time. So when the periods are irregular, when they're heavy, when they're painful, it's really important to at least get an evaluation, talk with a physician. Usually that is going to be with your OB-GYN, but it can start with your pediatrician, of course, and just see, is this something that's normal? Are there treatment options? What does that look like? And have an ongoing conversation.
Yeah, and I think that's so insightful. Where can our listeners learn more about you and your practice?
So I practice in South Florida. I am actually in the process of opening my own practice. It's called Enriched Gynecology, Rich like my name. So it's ENRITCHED. I also do a lot on social media, also under the Enriched tag. And I like to talk about these issues of periods and PCOS and endometriosis and fibroids and all of the things that affect our day-to-day health and our periods. So you can find me on social media or at my website, which is just enrichedgynecology.com.
Thank you so much. And, one last question I have for you is what do you tell parents that Google PCOS at midnight? Like, what is one thing that you wish that they wouldn't Google?
I do actually think, Google and AI can be helpful in the sense of just kind of pointing out to us what the potential problems might be. But it's really important, like Google and AI, they are not your physician and they cannot really look at the whole picture and put it together in the same way as talking with a trusted provider can. So I think Google is great for putting down questions, but then you really need to call your provider and sit down and look at the things in the context of what your personal health is or what your child's personal health is. Bring all of the questions that you have from Google, but realize that that's not the end all be all source.
I think what parents often don't realize is that periods are not just a monthly inconvenience. They are a vital sign. And when cycles are irregular, they're painful, they're excessively heavy, or they're missing, that's information. And that's the body really communicating. So, to
Mhm.
all parents listening, if your teen is struggling with acne, irregular periods, painful cramps, excess hair growth, fatigue, or mood changes, please know this. Those symptoms are not something to dismiss or normalize, and they deserve a thoughtful evaluation and compassionate care. And these conditions are manageable. Menstrual disorders are treatable, and early intervention can make a big difference, not just for fertility in later life, but also for metabolic health, for their overall confidence, bone health, also, which we didn't talk about very much, but it's very important for that, and their overall well being. So, Dr. Rich, thank you so much for sharing your expertise and your passion. And to everyone listening, if you found this episode helpful, please share it with another parent who might need it. And we'll see you next time on the Endo Kids Podcast.
Thank you so much.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.